Welcome back, everyone. For our last session of the September 3rd through 5th pre-licensing sessions, we have Nikki back with elderly, blind, or disabled Medicaid eligibility rules. So we can go ahead and get started.
Sounds good. Thank you, Elizabeth. Well, hope y'all aren't too sick of me talking because you've got me for this last session. But as Elizabeth said, that's it then. We're done with the last session for the pre-licensing. So hopefully we can make it through this together. All right. So as a reminder, if you have any questions, you can either type them in the Q&A box and we'll address them at the end of the session as long as we have time. Masiel's with me again to assist with questions. We'll answer everything we can, and anything we can't, we'll keep track of to get back to you all later. So the agenda for this session includes going over the purpose of this training, an overview of Medicaid, including the non-financial and financial rules, as well as the subprograms of Medicaid, and then finally some resources. The purpose of this training is to provide navigators, certified application counselors or CACs, partners, agents, and brokers with an overview of the eligibility rules for EBD Medicaid programs. Medicaid for the elderly, blind, or disabled, or EBD Medicaid, covers adults ages 65 and older and individuals who have been determined blind or disabled by the Disability Determination Bureau, also known as the DDB. Many people will often confuse Medicaid with Medicare. Medicaid is a joint federal and state program that provides high-quality healthcare coverage, long-term care, and other services to over 1 million Wisconsin residents, and is the topic of our conversation today. Medicare is a health insurance program administered by the federal government and divided into 5 parts. Part A, which provides coverage for hospitalization and skilled nursing facilities. Part B, which covers such things as doctor visits. Part BID, which covers immunosuppressive drugs for certain individuals without other health coverage. Part C, Medicare Advantage, an option that allows beneficiaries to receive their Part A and Part B services through a private insurer and may include additional services like dental, vision, and hearing coverage. And Part D, which provides prescription drug coverage. Again, Medicaid and Medicare are 2 different programs, and we're discussing Medicaid today. Let's first look at an overview of EBD Medicaid. As mentioned during the Badger Care Plus session, please keep in mind that this training provides an overview of the eligibility factors that will be considered for EBD Medicaid. It's not intended as a training on how to determine eligibility. Only income maintenance or IM agencies can determine eligibility for most programs. More information about specific programs and policies can be found in the Medicaid Eligibility Handbook, also known as the MEH, which you can find by following the first link shown on this slide. The policies described in this training are subject to change. Updates are available a couple of ways. The second link shown on this slide is a biweekly stakeholder call series hosted by DHS to provide information about eligibility policy updates and rule changes affecting Wisconsin programs, such as food share and Medicaid. And the last link shown on the slide, which was also given in the last session, takes you to a site where you can sign up to receive email updates regarding DHS programs and services. Full benefit EBD Medicaid includes many different programs. We'll start by giving you some basic information and then get into more detailed information about each one in a bit. Supplemental Security Income, or SSI Medicaid, is for people who are getting federal Supplemental Security Income, or SSI, payments. Individuals receiving SSI are automatically eligible for Medicaid and don't need to apply for Medicaid through the IM agency. SSI-related Medicaid is the basic EBD Medicaid program for people who are age 65 or older, blind or disabled, but who are not getting SSI. A Medicaid deductible allows people who are above the income limit for SSI-related Medicaid to become eligible for Medicaid after they have met a deductible. Special status Medicaid is for people who once received SSI but no longer do, and who meet the financial eligibility criteria for Wisconsin's SSI-related Medicaid after disregarding a certain amount of their Social Security income. Medicaid Purchase Plan, also known as MAP, is for individuals with a disability who are working or want to work. MAP has higher income and asset limits than SSI-related Medicaid and may require a premium payment. The Katie Beckett program is for children with disabilities living at home, in a foster care setting, or in another eligible community-based setting who require an institutional level of care. Because only the child's income is counted, it allows some children with special needs to qualify for Medicaid, even with higher family income. Wisconsin Well Woman Medicaid is for women under age 65 who need treatment for breast or cervical cancer or certain precancerous conditions. Institutional Medicaid is for elderly, blind, or disabled people who are living in a nursing home, hospital, or other institution. And Home and Community-Based Waiver, or HCBW Medicaid, allows elderly, blind, or disabled people with higher incomes to qualify financially for home and community-based waiver long-term programs. These home and community-based waiver long-term programs enable people to receive long-term care Medicaid to receive long-term care services and supports in their home or in the community rather than an institution. People need to qualify for full benefit Medicaid to enroll in these programs. If they do not qualify for any other full benefit Medicaid program but need those services, they may qualify for home and community-based waiver Medicaid due to the higher income limit. There are also some limited benefit Medicaid programs. Individuals eligible for these programs have limited coverage, not full benefit coverage. Emergency services covers services needed for the treatment of an emergency medical condition if the individual meets all program rules except for being a U.S. citizen or having a qualifying immigration status. Senior Care is a prescription drug assistance program for individuals who are age 65 and older. The Wisconsin Well Woman Program, also known as WWWP, is a limited benefit Medicaid program. It provides women ages 40 to 64, with some limited exceptions to the age group, specific preventative health screening services related to breast and cervical cancers. This is different than Wisconsin Well Woman Medicaid, which we talked about a few slides back. That was a full benefit coverage. The Medicare savings programs help individuals enrolled in Medicare pay their Medicare premiums, deductibles, co-pays, and/or co-insurance. So again, Medicare is that health insurance program administered by the federal government, has parts A, B, BID, C, and D. It's not Medicaid. But the Medicare savings programs are Medicaid programs that can help people pay some of their Medicare costs. And we'll talk about that more in detail in a bit. Let's take a look at some of the basic non-financial and financial rules for EBD Medicaid. Individuals must be elderly, which is 65 or older for Medicaid, or have been determined blind or disabled by the Disability Determination Bureau, or DDB, to be eligible for EBD Medicaid. As a note, some individuals may be eligible for what's called a presumptive disability determination. This is a method for temporarily determining a disability for an individual while a formal disability determination is being done by the DDB. Now, we're not going to be diving into presumptive disability information this morning, but I wanted to mention it because people often confuse presumptive disability with presumptive eligibility when they're two different things. Remember, we discussed presumptive eligibility during our Badger Care Plus session. It's that express temporary enrollment into Badger Care Plus or family planning only services based on the presumption of eligibility for those programs. Presumptive disability information can be found in Medicaid Eligibility Handbook, Chapter 5.9, while presumptive eligibility information can be found in Badger Care Plus Handbook, Chapter 40.2. All right, so individuals must be elderly, blind, or disabled to be eligible for EBD Medicaid. They must also be a Wisconsin resident, and they must also be a citizen or qualifying immigrant. Additionally, individuals must provide a Social Security number with a few exceptions. They must supply the required information and verification within the required time frame, and they must pay premiums or cost sharing if required by the specific program. Most EBD Medicaid subprograms have an income limit and an asset limit, but these do vary by program. Income limits for some EBD subprograms are based on the federal poverty level, or FPL, while others are based on the SSI federal benefit rate, or FBR. All limits are federally determined, and most are adjusted, usually increased, yearly. Current FPL amounts for EBD Medicaid can be found at the link shown on your slide. Most subprograms count the income and assets of the member and their spouse. There are some exceptions that apply to children with disabilities, though. Children are not subject to an asset limit or an asset test, and in some cases, parents' income is not counted or is only partially counted. Countable income for EBD Medicaid includes, but is not limited to, gross earned income, self-employment earnings, Social Security income, retirement benefits, unemployment insurance, income from trusts, interest and dividend income, child support, and alimony. Income types and rules are outlined in the Medicaid Eligibility Handbook, or MEH, Chapter 15. Countable assets for EBD Medicaid include, but are not limited to, cash, checking, and savings accounts, stocks, bonds, and certificates of deposits, or CDs, non-home real property, some vehicles, some trusts, some life insurance policies, some burial assets, some annuities, some loans, and some reverse mortgages. Asset types and rules are outlined in MEH Chapter 16. There are also some allowable deductions for EBD Medicaid, and those do vary by subprogram, but all EBD Medicaid programs allow a $20 standard deduction, as well as a 65 and 1/2 earned income deduction. The $65 and 1/2 earned income deduction is calculated by first deducting $65 of the household's total earned income, then deducting half of any remaining earned income. For example, if a household has $1,065 per month in total earned income, $65 would be deducted, leaving $1,000. Half of $1,000 is $500. So the total deduction would be $565, and the countable earned income would be $500. There are subprogram specific deductions as well. So depending on the subprogram being determined, some examples of those subprogram specific deductions include support payments, court-ordered attorney or guardian fees, impairment-related work expenses, and medical and remedial expenses. And we're going to take a closer look at some of these subprogram specific deductions when we take a closer look at those programs in a bit. All right, that brings us to our first poll question. Which of the following individuals may be non-financially ineligible for EBD Medicaid based on the information given? A, Janice, a 44-year-old who has been determined disabled by DDB. B, Edgar, age 68. C, Penelope, age 70, living in her home in Minnesota. Or D, Ricardo, a 24-year-old who has been determined blind by DDB. Which of the following individuals may be non-financially ineligible for EBD Medicaid based on the information given?
We'll give it just another 10 seconds for the poll.
All right, great job. The correct answer is C. Individuals must be a Wisconsin resident to be eligible for EBD Medicaid. Since Penelope is a Minnesota resident, she would not be eligible. Now that we talked about the basic non-financial rules for EBD Medicaid, let's take a closer look at each of the sub-programs in more detail. First, let's talk about SSI Medicaid. The federal SSI program provides cash benefits to people who have little to no income or assets who are 65 or older, blind, or disabled. SSI has income and asset limits similar to those used for EBD Medicaid. In Wisconsin, if someone qualifies for the federal SSI payment, they will also receive the state SSI payment. Also, if someone is getting SSI, federal and state payments, they automatically qualify for SSI Medicaid. This means they do not have to apply for Medicaid separately, and their eligibility for Medicaid is not determined by the IM agency. SSI Medicaid is a full benefit Medicaid program. Now let's talk about SSI related Medicaid. This is different than SSI Medicaid, which is the Medicaid someone receiving SSI payments is automatically eligible for, although the coverage for both of these programs is the same since they're both full benefit Medicaid programs. SSI related Medicaid is the basic EBD Medicaid program for people who are elderly or blind or disabled, as determined by the DDB, but who are not receiving SSI. Eligibility for this program is determined by IM agencies. The income limit for this program is 100% of the FPL. For one person, that amount is currently $1,304.17, and for a couple, 100% of the FPL is currently $1,762.50. SSI related Medicaid is outlined in MEH Chapter 24. SSI related Medicaid also has an asset limit. For a single individual, countable assets must be below $2,000, and for a married couple, countable assets must be below $3,000. If someone is over the income limit for SSI-related Medicaid, they can become eligible for SSI-related Medicaid by meeting a deductible. Deductibles are often also referred to as spend downs. Deductible rules are also outlined in MEH Chapter 24. Medicaid deductibles are calculated for a 6-month period by subtracting 100% of the FPL from the total countable monthly income in each month of the deductible period and adding the 6 remainders together. Again, 100% of the FPL for one person is currently $1,304.17. So for example, if a single person's countable monthly net income was $1,404.17 for each month of their 6-month deductible period, and the income limit didn't change for any of those months, they would be $100 over the income limit for each month, and their total deductible amount would be $600. Now, there are several ways to meet a deductible. Individuals can submit unpaid and recently paid medical bills, including Medicare and other health care premiums paid by the person, to meet the deductible. They can choose to prepay the deductible in order to obtain coverage, or they can have a combination of unpaid or recently paid medical bills and prepayment. Information about how to meet a deductible is outlined in MEH 24.7. Once a deductible is met, the individual is eligible for full benefit Medicaid coverage, and Medicaid pays for covered services from the point the deductible is met until the end of that 6-month deductible period, at which time a renewal would be due. Here's an example. Bobby is a single 68-year-old with total countable income of $1,671.67 per month. She applies for health care in July and is over the income limit for SSI-related Medicaid, so the IM agency calculates a deductible period for her from July to December, a period of 6 months. Since Bobby's income was the same for all 6 months, and since the income limit also remained the same for all 6 months, the total amount she is over the income limit for each month won't change and is $367.50 for each month. So the total amount of her 6-month deductible is $2,205. This is the amount she must meet before she can be eligible for Medicaid. On July 6th, Bobby has outpatient surgery and has unpaid medical bills that she does not anticipate any other entity to cover, totaling $3,500 from the procedure. She submits proof of these bills to the IM agency to meet the deductible. By meeting the deductible, she becomes eligible for Medicaid from July 6th, the date she incurred the bill, until the end of December, the end of her deductible period. Now, she is responsible for the portion of the bill she used to meet the deductible, so she will still owe the hospital $2,205 because that was the amount of her deductible. But the remaining amount of the bill, $1,295, can be billed to Medicaid, and Medicaid should pay as long as the bill was for services that are covered by Medicaid, also known as covered services. Covered services are outlined in MEH 21.4. And that brings us to our second poll question. Question number 2. Which of the following is not a true statement for SSI-related EBD Medicaid? A, the asset limit for a single person is $2,000 per month. B, SSI-related Medicaid deductibles are set up for a period of 6 months. C, the income limit for SSI-related Medicaid is 100% of the federal poverty level. D, the only way to meet a deductible is to prepay the amount. Which of the following is not a true statement for SSI-related EBD Medicaid?
And we'll give that another 10 seconds or so.
All right, great job. The correct answer is D. Prepaying a deductible is not the only way to meet a deductible. Individuals can also submit unpaid or recently paid medical bills to meet a deductible or have a combination of bills and prepayment. Next, let's talk about the Medicaid Purchase Plan, or MAP. MAP is a full benefit Medicaid subprogram, and eligibility for MAP is determined by IM agencies. MAP is for individuals with a disability who are either working or enrolled in a health and employment counseling program, also known as HEC. MAP allows people to qualify as disabled even if they're engaged in substantial gainful activity, or SGA, which means they're earning above a certain threshold. The program has higher income and asset limits to allow members to get healthcare coverage while they are employed. MAP information, including information about the Health and Employment Counseling Program, or HEC, can be found in MEH Chapter 26. The income limit for MAP is 250% of the FPL based on a household size that includes the member's spouse, and the member's minor dependent children. Stepchildren are not included in the household size. For example, if Fred was applying for MAP for himself only and his household included himself, his spouse, his spouse's minor child with someone else, and a minor child in common, Fred's household size would be 3, and his income limit would be $5,552.08 per month. The member and their spouse's net income is compared to the income limit for the household size. So for Fred, his household size was 3. So his and his spouse's income would be compared to that income limit for a household size of 3. MAP allows that $20 standard deduction and the 65.5 earned income deduction that we talked about earlier. It also allows an impairment related work expense deduction. You might also hear these called IRWIs, a special exempt income deduction, and a medical and remedial expense deduction if the applicant and spouse have medical and remedial expenses that total more than $500 per month. Premiums for MAP are charged based on the member's income only. If the member's gross income exceeds 100% of the FPL for a group of 1, currently that amount is $1,304.17, then an initial premium is required prior to enrolling in benefits, and a monthly premium payment will be required to maintain eligibility. Finally, the asset limit for MAP is $15,000, and only the member's assets are counted. So, in conclusion, household size includes the member, their spouse, and minor children of the member only. Net income includes the member and their spouse's income with allowable deductions. Premiums are charged based on only the member's income, and only the member's assets are counted. Now, if they have joint assets, those are also counted. Before we move on to long-term care Medicaid program information, let's discuss divestment. Divestment is the act of transferring ownership of non-exempt assets or income and receiving less than fair market value in return. A divestment penalty period is a period of ineligibility for long-term care services based on the amount divested or given away. Divestment penalty rules apply to all individuals receiving long-term care services, except children under 19 years old, children under 22 years old who are enrolled in the Children's Long-Term Support or CLTS waiver program, a person of any age receiving residential substance use disorder or SUD treatment in any setting if the person is only there to receive residential SUD treatment. Long-term care Medicaid programs include institutional Medicaid, as well as home and community waivers-based waiver programs, such as family care partnership, Include Respect I Self-Direct, also known as IRIS, Program of All-Inclusive Care for the Elderly, also known as PACE, which is available in Kenosha, Milwaukee, Racine, and Waukesha counties only, and Children's Long-Term Support Program, also known as CLTS. Institutional Medicaid is Medicaid for elderly, blind, or disabled individuals who are living in a nursing home, hospital, or other medical institution. Eligibility for this program is determined by IM agencies. The individual must have either resided in a medical institution for 30 or more consecutive days, or be likely to reside in a medical institution for 30 or more consecutive days, as attested to by the medical institution, in order to be eligible for institutional Medicaid. Medical institutions include, but are not limited to, hospitals, skilled nursing facilities, intermediate care facilities, and in some cases, institutions for mental disease. When someone applies for health care and indicates that they're in an institution or need institutional care, this is considered an application for institutional Medicaid. Eligibility and cost sharing for institutional Medicaid are determined based on income, assets, the cost of care for the medical institution, and other qualifying expenses. For a single individual, the asset limit is $2,000. For a married individual, some assets may be allocated to the applicant's community spouse. A community spouse is someone married to an institutionalized person and not living in a home or other medical institution for 30 or more consecutive days themselves. Moving on to income, for a single individual, the monthly income is 300% of the SSI federal benefit rate, which is currently $2,901. But they may also qualify if their income is less than their cost of care plus other expenses. For a married individual, some income may be allocated to both the applicant's community spouse and other qualifying community dependents. Qualifying community dependents are outlined in MEH 18.6.1. And divestment penalties may apply. Individuals eligible for institutional Medicaid who are serving a divestment penalty period remain eligible for card services only while they are in their divestment penalty period. Card services are outlined in MEH 21.4.1.1. While in a divestment penalty period, the individual's long-term care services are not covered, only those card services, which card services are basically the same as someone with Badger Care Plus has. Home and community-based waiver programs enable elderly, blind, or disabled people to receive long-term care services and supports in their own homes or community rather than in an institution. Individuals must be eligible for full benefit Medicaid program or HCBW Medicaid to be enrolled into a home and community-based waiver program, and divestment penalties may apply. Individuals must meet a certain level of care as determined by the Aging and Disability Resource Center, also known as ADRC. Individuals must contact the ADRC for enrollment counseling and to have their level of care determined. The ADRC will help to identify the most appropriate home and community-based waiver program for the individual. If the individual is already eligible for a full benefit Medicaid program, the ADRC can enroll the individual into the appropriate home and community-based waiver program. If the individual is not already eligible for a full benefit Medicaid program, the individual must submit a Medicaid application to the IM agency. To find an ADRC in your area, you can follow the link on this slide. Let's talk about that HCBW Medicaid. This is a specific form of full benefit Medicaid used to enroll individuals in a home and community-based waiver program when they're not eligible for any other form of full benefit Medicaid. For HCBW Medicaid, individuals must be elderly, blind, or disabled to be eligible. Remember, on the last slide, we said that individuals already eligible for a full benefit Medicaid program could be enrolled in a home and community-based waiver program by the ADRC, but if they weren't already eligible, a Medicaid application would need to be submitted to the IM agency. Individuals must have a nursing home level of care as determined by the Aging and Disability Resource Center, or ADRC. While the ADRC determines level of care, the IM worker determines eligibility for HCBW Medicaid, as well as any cost share amounts. They check for all other full benefit Medicaid programs first, and then if the individual is not eligible for any of those, they'll check for HCBW Medicaid. The financial rules for HCBW Medicaid are very similar to the rules for institutional Medicaid. including that some assets may be allocated to the applicant's community spouse. Some income may be allocated to the community spouse and other qualifying community dependents, and divestment penalties may apply. And that brings us to our next two poll questions. First, poll question 3. When determining eligibility for Medicaid Purchase Plan, or MAP, which of the following is not true? A, MAP has higher income and asset limits than SSI-related EBD Medicaid. B, assets of everyone in the home are counted for MAP eligibility. C, when determining if a MAP premium will be charged, only the member's income is counted. And D, when determining the MAP household size, stepchildren are not included. Which of those following statements is not true for MAP?
And just another 10 seconds, so I'll close this one out.
All right, great job. The correct answer is B. Only the MAP individual's assets are counted, not the assets of everyone in the home. And moving on to poll question 4. Which of the following is not true for institutional Medicaid? A, medical institutions include, but are not limited to, hospitals, skilled nursing facilities, and intermediate care facilities. B, for a single individual, the asset limit is $2,000. C, some income and assets may be allocated to an applicant's spouse. Additional income may be allocated to other qualifying community dependents. Or D, to be considered institutionalized, the individual must have resided or be expected to reside in a medical institution for 60 or more consecutive days. Which of those statements is not true for institutional Medicaid?
Just another few seconds, so we'll close that one out.
All right, great job. The correct answer is D, to be considered institutionalized. The individual must have resided or be expected to reside in a medical institution for 30 or more consecutive days, not 60 days. All right, now let's talk about Medicare savings programs in a little more detail. Again, as a reminder, Medicare is not Medicaid. Medicare is that health insurance program run by the federal government that has 5 parts: A, B, BID, C, and D. IM agencies do not determine eligibility for Medicare. Medicare savings programs are Medicaid programs, but they are limited benefit Medicaid programs, not full benefit Medicaid programs. that help individuals who are enrolled in Medicare pay their Medicare premiums and, in some cases, their Medicare deductibles, co-pays, and/or co-insurance. IM agencies do determine eligibility for Medicare savings programs. Now, you may hear these programs referred to as simply MSP, Medicare Savings Program. Sometimes you may hear them referred to as Medicare Premium Assistance, or MPA. Or for those of us that really want to reveal how old we are, like me, you might hear them referred to as buy-in. MSP asset limits are tied to the Consumer Price Index and are updated annually. There are 4 types of Medicare savings programs that we're going to talk about today. The first is Qualified Medicare Beneficiary Income, also known as QMB. To be eligible for QMB, the individual must be entitled to Medicare Part A or Part B ID. The income limit is 100% of the FPL for a group size of 1 or 2, and the asset limit is $9,660 for a single individual and $14,470 for a married couple. If someone is eligible for QMB Medicaid pays their Medicare Part A, although most people don't have a premium for Part A, Part B and Part B ID premiums, and their Medicare deductibles, co-pays, and insurance. QMB is like the jackpot of the Medicare savings programs. Also, QMB is the only Medicare savings program where the member will get a forward health card if they're eligible to use when paying for those Medicare deductibles, co-pays, and co-insurance. Now, that can sometimes confuse members. They think because they have a forward health card, they must be eligible for full benefit Medicaid. But that's not true if they only have QMB eligibility, because QMB eligibility is only going to pay for Medicare premiums, co-pays, and deductibles, and co-insurance. Some Medicaid members are automatically eligible for QMB. People eligible to receive SSI payments automatically receive QMB benefits as part of their SSI Medicaid benefits package. So people receiving SSI, remember, are automatically eligible for Medicaid, so they don't need to submit an application to IM for their Medicaid. And they're also automatically eligible for QMB, so they don't need to submit an application to IM for Medicare savings programs either. Some Medicaid members who once received SSI but no longer do are automatically eligible for QMB, including 503 assistance groups and disabled adult child, or DAC, assistance groups. Both 503 and DAC are special status Medicaid, and you can find out more about them in MEH Chapter 25. The next Medicare savings program is Specified Low Income Medicare Beneficiary, also known as SLMB or SLIMB. In order to be eligible for SLIMB, the individual must be receiving Medicare Part A or Part B ID. The income limit is 120% of the FPL for a group size of 1 or 2. And the asset limit is $9,660 for a single individual and $14,470 for a married couple. If someone is eligible for SLIMB Medicaid will pay their Medicare Part B or Part B ID premiums only, not the jackpot. QMB is still a jackpot. The next Medicare savings program is Specified Low Income Medicare Beneficiary Plus, also known as SLMB Plus or SLIMB Plus. In order to be eligible for SLIMB Plus, the individual must be receiving Medicare Part A or Part B ID. The income limit is 135% of the FPL for a group size of 1 or 2. The asset limit is $9,660 for a single individual and $14,470 for a married couple. And the individual may not be enrolled in another Medicaid program, whether that's a full or limited benefit program. If someone is eligible for SLIMB Plus Medicaid will also pay their Medicare Part B and Part B ID premiums just like SLIMB. The difference between SLIMB and SLIMB Plus is that Slim B Plus has a higher income limit, and individuals eligible for any other form of Medicaid cannot also have Slim B Plus. They must choose one or the other if they're eligible for both. The final Medicare Savings Program is Qualified Disabled and Working Individual, also known as QDWI or QDWI. In order to be eligible for QDWI, the individual must be under age 65 and disabled. The individual must have lost premium-free Medicare Part A as a result of returning to work. The member cannot be eligible for any other Medicaid. The income limit is 200% of the FPL for a group of 1 or 2. And the asset limit is $4,000 for a single individual and $6,000 for a married couple. If someone's eligible for QDWI pays their Medicare Part A premiums. And I'll just say 17 years as an IM worker at an agency, and I never had somebody eligible for QDWI. So don't think it's all that common, but I wanted to mention it. Let's talk about some other sub-programs. EBD Medicaid Emergency Services is a limited benefit Medicaid program that covers services needed for the treatment of an emergency medical condition when someone meets all EBD Medicaid program rules except citizenship or qualifying immigration status and having or applying for an SSN. So this means the individual must either be elderly, 65 or older, or determined blind or disabled by the DDB, or be eligible for presumptive disability, which we talked about earlier, to be non-financially eligible for EBD Medicaid emergency services. As we discussed earlier, emergency services is not available for childless adults, adults ages 19 through 64 who are not living with and caring for a child under 19 and are not certified disabled or presumptively disabled. It's not available for children with higher incomes or women enrolled in the Badger Care Plus prenatal program. While emergency services applications are processed by IM agencies, it's not the responsibility of the IM agency to determine if the applicant's condition is or was an emergency condition and reimbursable under EBD Medicaid emergency services. It is the IM agency's responsibility to manually determine if the non-qualifying immigrant meets all eligibility requirements during the dates of service and certify if he or she is eligible for emergency services. Medical providers who have treated a non-qualifying immigrant for emergency services may complete the certification of emergency for non-U.S. citizenship form F01162 to verify that the services provided were to treat an emergency medical condition, and the patient can provide that to the local IM agency when applying for assistance, although the form is not required. Additionally, a provider's certification of emergency by completing that form F01162 does not guarantee reimbursement. When the medical provider submits claims for emergency medical services to the fiscal agent determines if a condition is an emergency medical condition covered by emergency services. More information about emergency services can be found at the link shown on this slide. The Katie Beckett program is a full benefit Medicaid program for children with disabilities who are living at home, in a foster care setting, or in another eligible community-based setting who require an institutional level of care. Because only the child's income is counted, it allows some children with special needs to qualify for Medicaid, even with higher family income. Applications for Katie Beckett are processed by DHS, not by the IM agency. More information about Katie Beckett can be found at the link shown on this slide. The Wisconsin Well Woman Program, or WWWP, is a limited benefit Medicaid program. It provides specific preventative health screening services related to breast and cervical cancers and is different than Wisconsin Well Woman Medicaid, which we'll talk about next. Individuals can apply for the Wisconsin Well Woman Program through their county or tribal Well Woman coordinating agency. More information about the Well Woman Program can be found at the link shown on this slide. Wisconsin Well Woman Medicaid, or WWWMA, is a full benefit Medicaid program that provides comprehensive health care coverage for women under age 65 who have been diagnosed and require treatment for breast cancer or cervical cancer or certain precancerous conditions of the breast or cervix. So often women may be enrolled in the Wisconsin Well Woman program, which provides those preventative screenings, remember. And then if breast, cervical, or other precancerous conditions are found, they may then enroll in Wisconsin Well Woman Medicaid for treatment. Eligibility for Wisconsin Well Woman Medicaid is based on enrollment in the Wisconsin Well Woman Program, WWWP, or Family Planning Only Services, FPOS. So no separate income or asset test applies. Applications are processed by the Department of Health Services, not by IM agencies. And more information about Wisconsin Well Woman Medicaid can be found at the link shown on this slide. Senior Care is a limited benefit Medicaid program and provides prescription drug assistance for individuals who are age 65 and older. Applications are processed by DHS, not by the IM agencies. For more information about senior care, you can follow the link on this slide. And that brings us to our last poll question. Which of the following programs is not a full benefit Medicaid program? SSI-related EBD Medicaid, B, Medicaid Purchase Plan or MAP, C, Medicare Savings Programs or MSP, or D, Well Woman Medicaid? Which of those programs is not a full benefit Medicaid program?
And we'll give that just another 10 seconds and close that out.
All right, great job. The correct answer is C. Medicare savings programs are not full benefit Medicaid programs. MSPs help individuals who are enrolled in Medicare pay their Medicare premiums and in some cases, deductibles, copays, and or co-insurance. And it looks like there was a question in the chat that says, can you please go over Slim B Plus? So we did go over Slim B Plus when we discussed Medicare savings programs. Is there a specific question you have about Slim B Plus? I don't know if they're able to take themselves off mute or if they have to put the questions in the question and answer.
They have to put in the question and answer. I'll keep an eye on it. I'll keep an eye.
Okay. All right, let's take a look at some additional resources. Online policy resources such as policy manuals, handbooks, forms, and directories can be found by following the first link on this slide, and the specific link for Medicaid Eligibility Handbook is also shown here as the second link on this slide. And that does complete our presentation for today, but we do have plenty of time for questions. So questions about EBD Medicaid, deductibles, MSPs, anything.
Nikki, there was something that was in the question and answer that I addressed. I think it's just important to point out that if anybody is receiving Medicaid through the Social Security office and they need to make changes or report anything, we should really encourage those folks to work with the Social Security Administration to address those changes and questions because of the
Oh.
fact that we didn't grant that benefit to them.
Yep, I see that question and that you answered it. If a patient reports they receive SSI payments but don't have active Medicaid for forward health, who should we contact? And that is the Social Security Administration, as Masiel mentioned.
It's just a good call out. Thanks, Nikki.
Yep, absolutely. Any other questions? Oh, which EBD MSP programs have dental coverage? EBD MSP. So full benefit Medicaid programs, I believe, do have dental coverage. Is that correct, Masiel?
Absolutely.
Yep. But MSPs are limited benefit programs. MSPs, QMB, SlimB, SlimB Plus, and QDWI are not full benefit Medicaid programs. Those would not have dental coverage. So anything that's not a full benefit coverage, anything that's got limited benefit coverage would not have dental coverage, correct, Masiel?
At least on the Medicaid side of the things.
On the Medicaid side,
We're not
yes.
sure what, if anything, they may have that they're paying out of pocket for on their own.
Yeah, like supplemental stuff.
Exactly.
That's completely separate from Medicaid.
At least for our world and our response.
Yeah.
Yeah.
It's a great question, though. Any other questions? How are we figuring out the math for different scenarios? I think I need a more specific question about that. Number one, you don't have to figure out the math. You just have to make sure the member is reporting the income and the assets that they have, and the IM worker at the agency will figure out the math on their end. And then unless they are Medicare eligible, then they wouldn't have access to dental if they also have Medicaid. Unless they are Medicare eligible. Oh, so you're saying if someone has Medicare and Medicaid, then they don't have access to dental? Is that correct? Is that what you're saying, Carrie? Okay. And will there be math on the CAC test? That's not a question I can answer. I don't have anything to do with the CAC test. Any other questions? Can I go back to the slide on the SlimB Plus program? Absolutely. Oh. There you go.
And then we will also have the video recordings and slides posted on our website once everything gets downloaded and fixed. So it may be Monday for today's sessions, but I will have more information about that in the chat in a little bit, but I just wanted to mention that real quickly.
Sounds good. Thank you. Yeah, all of the PDFs will be available. So every place that I said that the link is on your slide, you'll have access to those links directly in the PDFs. They would if they have full benefit Medicaid, though, and a Medicare plan like the Dual Complete, where patient is enrolled in MA and Medicare. So now you're getting into questions about benefits for individuals enrolled dually eligible, MA and Medicare, and I can't answer those questions. I can't answer those Medicare related questions. I can only answer the Medicaid questions.
I'm going to drop the Forward Health Partner inbox link
Perfect.
for Michaela so she can go ahead and follow up with us via
Sounds
that
good.
email address.
Awesome. Thanks, Masiel.
Absolutely.
Any other questions? I'm happy to try and answer them. No question is stupid. I still have questions. quite honestly, regularly. So can we suggest people calling ADRC for help on these questions? For dual eligibility questions, I'm not
Yes.
sure that is the ADRC able to answer those questions on benefit or on covered services?
Yes, they should be able to. We go ahead and they should be able to answer at least most of the questions that you have. We will be having a session on Monday at mid-morning to talk about some of the sub-programs that we have for Medicaid. And along with that, we will have Masiel, who is with the ADRCs, to be able to answer and address questions. So I would encourage them to join that session.
Yeah. Masiel Grushinsky is an excellent resource for those types of questions. So yes, if you can attend that session on Monday, that is recommended. All right. ADRC, just for anyone who is trying to apply via the marketplace?
No, absolutely.
No, ADRC does not help people apply at the marketplace. When calling the DHS call center with a question on emergency Medicaid, is it acceptable to be reaching out to the EBD queue? It depends on if the individual is an EBD member. So are they elderly, blind, or disabled? If so, then yes, that would be appropriate. Updates to Medicaid programs eligibility due to legislative changes. That will be reviewed next week, correct? Yeah, we won't be talking about any updates about legislative changes this week or today.
No, currently right now, it's business as usual. Nothing has changed with the eligibilities for Medicaid and food share. We may have some information to share in the opening remarks by our Medicaid Director, Bill Hanna, but on Monday. So stay tuned for that. But when the department has communications to share, we will more not only share that information with our members, but we will also continue to share that information with our partners so that you are in the know when you're working on a daily basis with our mutual clients. So more to come on that, Michaela.
Yeah, as you can imagine, there's a lot of research that goes into figuring out what everything means, and it takes time. So
absolutely.
Any other can covering Wisconsin? Oh, that's a covering Wisconsin question.
I'm sure we'll work with you, Elizabeth, to try to get that information out.
Yep, that's exactly what I was going to say. We partner closely with DHS, and we have information for everybody who has been with the conference, and we can definitely get that information out through our email once we learn more about what will be happening. Like Masiel said, right now it's business as usual, so we're just waiting to get more information.
I also want to mention, if you do have any additional questions, you can direct them to the Forward Health Partner inbox at the email address shown on this slide. But we do still have some time left in our session today if you have additional questions. Going once. Going twice. All right. Well, thank you all so much for your time and attention. It's been my pleasure to spend time with you the last Wednesday and today. And I hope you have a great Friday and a great weekend. And hopefully the weather is nice, at least sunny, even if it's not warm enough.
I know, right? It feels like fall, but it'll be warm again soon, I'm sure. Thank you again, Nikki and Masiel, and Sharon, Shelley, and Adam for their presentations the last 3 days. Thank you all for joining us. If you have missed any pre-licensing sessions and you would like to watch the recordings, I will be putting that link in the chat. If you missed sessions and will be viewing the recordings for credit hours, you will email me with that attestation and which recordings you completed, and I can provide that attestation and credit hours to the Office of the Commissioner of Insurance towards your pre-licensing certificate. We look forward to joining you again for the rest of our conference, which starts Monday, September 8th and runs until September 10th. And the timing for those sessions are 8:30 a.m. to noon. And as a reminder, we will be having our office hour on Friday, September 12th from 1 to 2. This is not required. It does not count towards pre-licensing credits. It is a place where you can ask questions about what you've learned and ask questions about other requirements and processes for becoming licensed. So I hope that you all have a wonderful weekend, and we will see you again on Monday. Thank you.